welcome to 2023, which we hope is going to be a landmark year for healthcare all around the world. There's some hugely exciting things going on globally, and healthcare world is hoping to be a part of them. And as ever, the healthcare schedule globally always starts with Arab Health, with the largest gathering of international healthcare people from around the world in Dubai at the end of January. And today's session, I'm going to be joined by some fantastic guests to discuss Arab Health, the opportunities that come out of it. And I'm really looking forward to sharing some of that insight and some of that excitement with you all. I am Steve Gardner. I'm the Managing Director of Healthcare World, the world's leading international healthcare magazine. And my first guest this morning, I've just discovered, has done as many Arab Healths as I have, which is in itself a remarkable achievement. It's 12 years of Arab Health that I've now done. And for all of those 12 years, the man who's been making it all happen has been Ross Williams from Informa Markets. Good afternoon, Ross. How are things 2 weeks out? How are you looking?
We're good. Thanks for that reminder, Steve. Yeah, we're really good. As you can imagine, it's all hands on deck at the moment, making sure everything's in place and ready to go. The show is sold out, so now our focus turns more to the visitors and the delegates, making sure that the guys that we want on the show floor are here for the 4 days. So it's a vital time for us to make sure everything's ready for the first day of the show.
And of course, one of the key tasks you've got there is making sure that the copies of Healthcare World are available at the entrances as people arrive. So look, I mean, what I'm really interested in, I think, is, the longevity of Arab Health. Because it's interesting, isn't it? There are all sorts of healthcare events around the world. And yet, the one that we all of us in this madcap international healthcare community, we all gravitate to Dubai at the end of January. Why is that? What is it that's made Arab Health this kind of behemoth of international healthcare?
Well, I think in those 12 years that I've been working on the show, and I think probably previous to that as well, the overall perception of Arab Health has changed. I think probably in my earlier days, it may have been seen more as a Middle Eastern or regional event. But definitely over time, the importance of the show has grown massively. It's very much now seen as a global show. While we have always had that international exhibitor presence, I think that the global visitor presence has grown over that time. And Dubai in the UAE is a huge global trading hub. It's very easily reached, from all over the world. It's very centrally located for lots of different places. So that really helps us. I think, I looked at some numbers. I think 30% of our visitor audience in 2022 came from outside of the GCC and the Middle East. Previously, it was higher than that, but now in 2023, with no or much more relaxed travel restrictions, we're looking forward to pushing those numbers back up to much higher than that, and then increasing that as we go on forward year on year.
How many different countries around the world are people coming from? I mean, will you give us an insight into the different nations that are there?
I think it's around 160, 170 countries, that are represented across the show. And that's huge. What we find more is Asia, Africa, those kind of regions are becoming more and more involved in the show. And I think if you're an exhibitor at the show, what you find at Arab Health is it's a place to do business. It's not just a place where you will come and meet your partners that you've been working with for a long time. Obviously, they're there, but it's still a place where you actually do deals, where you agree contracts and sign things off. And along with the exhibition, it's not just a trade show. I think one of our biggest USPs is the fact that we run these high-level CME accredited conferences alongside the show, which attracts a slightly different audience. So we get the buyers, but we also get the end users. So those companies that are not necessarily looking for distribution networks also get face-to-face opportunities and face time with those guys that are using the products or that are recommending that their hospital, clinic, or whatever it is, buy those products in the long run.
It's always amazed me that when you look at Arab Health, it's beyond being a trade show from the perspective that there's as much there's almost an ecosystem of international healthcare that sets up for a week in Dubai. And you've got all of these, keeping an eye out on the schedule of satellite events. I mean, Healthcare World, we have our reception on the Monday evening. We've got a couple of panel sessions that we're doing with Altamini, a couple of breakfasts in the morning. And it's keeping an eye on all of these different things that are going on around the show and all of the different, I think for those that are new to it, do you think it can be a little bit? I mean, it's what sort of numbers are you looking at this year? Can it be a little bit overwhelming to a newbie?
I think we're expecting over 3,000 companies, and I think it's 51,000 visitors through the door over those 4 days. What we did in 2020, actually, because previous years it was just a mix of products and services all over the exhibition floor. So you might be meeting one partner in one end of the show and have a 20-minute, half an hour walk to go and see the other. What we actually did in 2020 was sectorize the show. So it's a lot more organized, and if you're looking for, say, a disposables product, then you can go to that specific area of the show. So I think now it's maybe not so overwhelming. I think if you walked in not knowing where you're going, then it probably would be. We take over the entire Dubai World Trade Center. We're 5 halls bigger than last year and about 30% bigger overall than we were last year. So I think that just shows the appetite from the industry to have that face-to-face contact again.
I mean, I was going to ask you about that because, last year was a strange experience because obviously you ran one during COVID that was much, much smaller. But last year was the return to, I guess, what you and I would think, given our experience, was a normal Arab Health. But it was still a little bit lighter. How's it changed for this year?
Well, I think, as you say, we were fortunate to be able to continue to run a show in 2021. Dubai was open. There were still restrictions, but the appetite was there, as I said before. And 2022 was a really strong bounce back. It was actually much stronger than we originally anticipated. I think a lot of the companies that missed out in 2021 realized that they needed to be back on trade show floors again. I think last year, because we had Arab Health and MedLab combined, it was a very strong show. And even though some of the restrictions, were still in place, it was successful. We had lots of happy clients, lots of happy visitors. The conference programs run as scheduled. We introduced new programs such as the Future Health Summit. But now we're back. We're at 98% of our pre-pandemic levels when it comes to space. Next year, we're going to be way ahead of that, and way ahead, literally a year ahead of where we anticipated being. So I think the demand, the healthcare market, wants Arab Health, and it wants MedLab, and it wants these events to happen.
Are there going to be any restrictions this year? One of the most difficult things last year, I think, was walking around trying to have meaningful business conversations from behind a mask. Is that all? Are we de-restricted this time around?
No, the restrictions lifted in Dubai. I think it was October, November time, which was great. Obviously, we were again very fortunate in Dubai and the UAE that restrictions were put in place very early, and things like the masks had a huge effect. That's all gone now. That's all over and done with. But as a trade show organizer, we still have a duty of care to our visitors and to our exhibitors. We'll still have things like sanitization products spread out across the venue, just to make sure that we have some things in place for people to feel comfortable. And if you want to wear a mask and you're more comfortable wearing a mask, then we obviously do what you're comfortable with.
Coming back to the content of the show and the people that get involved and the people that come along, how important is it that you have all of that kind of government level support from across the region? Because you always have big stands from the Dubai Health Authority, from the Ministry of Health and Protection, from NUPCO and the various organisations in Saudi Arabia. How important is that government level support?
It's huge for us. They are dictating policy and regulation in this part of the world, and for us to have their support and for them to be showing the region or the world even what they're doing next, what they're implementing. I know last year there was focuses on from the Ministry of Health and Prevention, for example, on telehealth platforms, and that what that evolves into in regards to metaverse and stuff we'll come on to a bit later, I think. But I don't think there's many other shows, and certainly not ones that I've been to in the past, that have this participation. The Dubai Health Authority are very big on innovation. A few years ago, they were demonstrating, robotic arms and this kind of stuff, and what they do in their innovation centers. This year, I would say we have a giant presence from the health authorities across the UAE. We have a huge space from the Ministry of Health and Prevention, Dubai Health Authority, and Department of Health, which is essentially taking up a whole hall. We have massive support from Emirates Health Services, Dubai Healthcare, City Authority. We also have Pure Health, who have come on board this year, who have essentially over the last 2 years, I would say, or 3 years, have become one of the biggest healthcare platforms in the whole region. They
grew enormously through COVID, I think. They were doing the testing at the airport last year. Yeah. They've really become a major player, I think, in the Dubai health economy, haven't they?
Yeah, so they're now one of, they have a huge space at the show. They are one of our biggest sponsors. They're participating in a lot of content that we're running across the exhibition. So I'm excited to see what they're going to bring. As far as I'm aware, they're bringing basically all of their partners within the company. So it's going to be a really interesting addition.
And it's also, one of the things that I didn't maybe realise until we were going through the kind of COVID period and we were having conversations about how the shows were going to run was just how important this show is to the government of Dubai, from the point of view of the fact that it brings in tourism, it brings in a huge number of visitors at the beginning of January. You have a lot of support and actually are driven quite a lot, aren't you, by the government of Dubai wanting this to be a success?
Yeah, trade shows are a huge part of what we do in Dubai. As I said, it's a massive global trade hub. If you look at other shows that are run here, similar size to Arab Health, things like GITEX and Gulf Food, it does bring in huge tourism. It's vital that these events go ahead. And what we like to do, and what my role as exhibition director is to do over the next couple of years, is align with the authorities and align with the government of Dubai to look at their visions, what they see the future of Dubai looking like, what the healthcare system in Dubai and the UAE is going to look like in a few times, and how we align the event, more with that to make sure that we're delivering on what the region is looking for.
Because that was my next question. At the end of the day, Arab Health is this enormous behemoth, this big, indelible block in my diary at the end of every January every year. How do you innovate? How do you change? What can you do differently? How can you develop this going forward? What's the next step for Arab Health?
Well, what we like to do as a team, obviously after a couple of weeks of being back and having a bit of downtime, we have a big feedback meeting. We get the whole department, or the whole healthcare department here in Informa to sit down. We take mass feedback at the show from our exhibitors, from our delegates, from our visitors. And we ask them what they want to see, what did they like, what don't they like, and then we kind of formulate a plan again. So we're already looking at 2024 and beyond at the moment. And again, that's my role in how we make that happen. But there's new things that we've added to the show as we've gone on. A few years ago, we had 3 startup companies. Now we have about 30. We have a whole startup pitching competition through the Innovate Talks platform. We have a healthcare transformation seminar and program that runs alongside the show. And this year, one thing that I'm excited about, and for those who may have attended HIMSS in the past, would probably have seen the Intelligent Health Pavilion. So we're working in partnership with the Intelligent Health Association in the US to deliver the pavilion at Arab Health. It's taken a long time for us to get to this point, and we've been working kind of on and off and having conversations since 2019 with these guys. What we will be doing is we're building essentially 3 live demo rooms on the show floor with an ER, an OR, and an ICU. And what that does is it gives our visitors and delegates the chance to experience live workflows to deliver better patient care. So as a participating company, you get the opportunity to place your product in the relevant room. And then the visitors get an audio tour of each of the use cases in each room and for each product. And there's a flow from room to room based on a number of live medical situations. So we'll have actors, we'll have volunteers, lifting up a product or moving the patient and pressing buttons and doing whatever it needs to show this is what would happen in this situation. So that for me is something that it's been a bit of my baby over the last couple of months, making sure that we bring all the pieces together, bring the sponsors, work with the partners to deliver the content around it. And now it's delivering it onto the show floor, making it happen, putting all the pieces into place, because it's not just an exhibition stand, it's a hospital room on the show floor. So we need to make sure that everything talks and the network that goes behind these products is actually there in place so that it's realistic.
Wow, that sounds like quite an endeavour. Listen, we're going to ask everybody this, I think, at the end of the sort of segments of the show today. What's your, you've been doing this for a long time, as have I, but we still see it, don't we? The look of sheer confusion and wonder on the face of somebody attending Arab Health for the first time and going, what the hell have I just walked into? What's your kind of top tip for newbies? If you're new to Arab Health this year, what's your top tip in terms of how to get the best out of the event?
From a visitor point of view, I would plan your day. We have lots of opportunities. We have an online platform where people can find our visitors, find the stand numbers, find the product sectors and all that kind of stuff. I would really look at that, look at who you're interested in, what products you're interested in finding, and plan your day around that. There's lots to see. There's lots of people to meet, lots of new things happening all over the show. So try and engage with them as much as possible. And this year, what we've also added is something that we call In the Village. So what that is, it's a nice big outdoor space, essentially kind of like a bar and restaurant area for people to unwind, to network, to relax after a long day or a long few days at the exhibition. And we're really looking forward. There's trade shows world over, no matter what industry you're in, there's never any seating anywhere. Because we as exhibition organisers want to sell all the floor space. So there's a huge, I think it's something like 3,000 square meters space for people to really relax, unwind, and during the day they can meet their clients, they can network and see their partners and just catch up. So I would definitely recommend going to that once your day's finished.
That sounds like a perfect tip to end our conversation on, Ross. Thank you so much. And I look forward to seeing you in Dubai. You never know, we might even get a beer in this year. It's been known to happen. Thanks very much.
Thanks, guys.
So moving on then. So there you go, a bit of insight into the show as a whole. And one of the things that Ross talked about there is one of the things that's new for this year, which is the addition of, on Thursday, an event at the Museum of the Future, for which you can register your interest on the Arab Health website, about healthcare in the metaverse. And I'm delighted to be able to welcome the organizer of that event and one of the key top participants, Reem Salah from Informa, who's been organising, and Dr. Timothy Whittam, who from Johns Hopkins, who has a truly interesting tale to tell that we'll get into a moment that hopefully will give us an insight into the metaverse. Reem, firstly, if I can come to you, tell us about the event. What is it that you're doing on Thursday? How do people get involved?
Okay, thank you, Steve, and the team, specifically Alison and Vito, for organizing such an important session. Much appreciated. In regards to the Future Health Summit, which is it's basically an exclusive high-level event where hot topics on healthcare are discussed, and where it's a platform designed to network with key influential stakeholders in the region's healthcare infrastructure. So that's in a nutshell what Future Health Summit is. For this edition, which will be held at the Museum of the Future on Thursday, February 2nd from 11 to 2, which note is day 4 of Arab Health. The event is by invite only. Now, we are going to be delivering an event where you could look at it from two angles. One angle is the networking element that the event provide. So we're creating an exclusive space for C-levels in healthcare, for CEOs in hospitals, for government entities that are involved heavily in healthcare, and they will have the chance and opportunity to network together, to exchange ideas, and to discuss the hot topic, which brings us to the other angle of the event, which is the content side of it. So the theme for this year, for this edition, is the metaverse in healthcare. Now, metaverse is a new concept. It's a shift in how we interact with technology. It has the means to impact healthcare. And by taking advantage of those different technologies, we're talking about artificial intelligence, augmented reality, quantum computing, robotics, and much more, but ultimately to improve patients' outcome. So what we have done is we have brought in industry leaders. From one side, they would be showcasing their tech, and we've brought industry leaders as well. And one of them is Dr. Timothy with them. And I'm honored to say currently he is with us in the panel session, and he'll be highlighting for us the benefits of the metaverse in healthcare. And do note that Dr. Timothy is one of the first surgeons to actually deliver a spinal surgery using augmented reality. So I'll leave the room for Dr. Timothy.
Well, yeah, thank you for that. That's a really helpful introduction. I think, yeah, I'm quite looking forward to this bit because, I mean, firstly, Dr. Weston, what did you do? How did you?
Yeah, well, I've had the opportunity, and firstly, thank you very much for the opportunity to be involved with this prestigious panel offering here. And I've had the opportunity to attack, I guess, healthcare and the metaverse through one angle, and that has been through the use of augmented reality, which is when you take a computer-generated image and you overlay that image on your view of the real world. And what that's helped us to do in spine surgery is it's allowed us to have essentially X-ray vision to place spinal instrumentation in patients more accurately and more efficiently. And so that's sort of my area of expertise. But the metaverse encompasses much more than just that. And so if we think about the metaverse, the definition of it is it means a lot of different things to a lot of different people, and it's sort of this nebulous term that's out there. But sort of what it means to me, and I think Reem touched on it, is it's when we take these enabling technologies and we allow them to interact rather with high power computing and the internet, and use this combination of technologies to improve our world in any area of the world. And obviously, in this case, it's healthcare. And so maybe a more formal definition, we would call the metaverse, it's an imagining of the internet as an immersive virtual world that is facilitated by the use of virtual and augmented reality tools. It will integrate physical and virtual realities, enabling humans to interact with their avatars and the environment. And we rely on these supportive technologies like high-speed internet, virtual reality, augmented reality, artificial intelligence. And all of this will be driven by, high-powered computing. So it's really kind of the future of medicine. Where are we going? It's going to be more technology based. We know that. And I think we're just getting started, but I think it's very exciting and it's fun to think about.
So let's talk about the example of what you've done, of what you've already achieved. So there's a spinal surgery done using virtual reality. How does that work? I mean, just as a concept.
Right now, the way it works, in the current situation, and there are several iterations of this. I was the first to use a novel headset. And basically that headset, which someday is going to turn into glasses, someday may turn into contact lenses. I mean, this technology is going to it's gonna be much more streamlined, if you will, just like other technologies, just like the cell phone started out as these big clunky things, and now we can stick these little devices in our pockets. But right now we have a headset, and the way it works is while we're doing the surgery, we do a scan of the patient inside of the operating room. One of the upcoming in the near future developments will be actually avoiding having to do a scan inside the operating room, but doing it before the surgery. But right now we do a CT scan inside the operating room, and we register a data set, and we take that data set and it gets integrated into this headset. And then when we look at the patient, the headset is seeing a marker on the patient, and then it is also seeing the tool that we use, and it's integrating that with the data set that came from the computer generated images of the CT scan. And now we have X-ray vision. So while I'm looking at the patient, and I'll show examples of this at the conference, I have a heads-up display that where I'm seeing the reality, which is the patient, and you know who I'm operating on, just as I traditionally would. But now that reality is augmented, if you will, by these computer-generated images of the X-ray, and it's showing in real time what I'm doing, where my instrument is going, relative to those. So
it's literally, you've got an augmented view of the patient. It's an overlay.
Yes. Yeah, it's an overlay. That's right.
That tells you exactly what
I'm doing and where I am.
Yeah. Wow. Yep. That's an incredible. Yep. And how far away? I mean, we'll talk a little bit more broadly about the implications of that and the extensions of that. How far away are we from that becoming standard operating procedure for this kind of surgery?
Yeah, well, it's interesting. I mean, that's an interesting question that I guess I really don't know the answer to, but I do believe that this technology is here to stay, and I do believe that it is going to be more refined and more developed and improved, if you will. But one of the big obstacles or hurdles, if you will, in the early tech world and early technologies is the adoption. And if you look at surgeons in particular, our group is a group of folks who are sort of stubborn, if you will, and we're set in our ways because it works for us.
A stubborn doctor, who knew?
Yeah, well, it's true. But the adoption is the big one, and getting everybody to adopt these newer technologies can be a challenge. But one of the things that we're doing, for example, at Johns Hopkins University in our training program is that we are offering different technologies that are part of the metaverse to our residents who are in training, and they can pick and choose, and they can help move the field forward. So, for example, one of my colleagues has invented one of the first robotic devices for doing spine surgery. And so, now our residents can look at the use of robotics, they can look at the augmented reality technology. And then one of my partners is, he's a guy that still thinks that the traditional way of doing things works well, and it does. So they have an advantage to look at all these different technologies and then move the field forward.
But I suppose, I guess the advantage of doing it at Johns Hopkins, doing it at medical school level with people that are newly qualified or are still in the early phases of their careers and their learning is the fact that you're able to get them, I guess, socialized into the idea of using this kind of technology, and that's how it will ultimately spread itself out into standard work. Is that the kind of the idea?
100%. And the interesting thing about it is that, when I think about these new enabling technologies like virtual reality and augmented reality, I think about sort of this futuristic gaming technology. And if you think about that, our teenagers and our kids are doing these things, and guess what? They pick it up very quickly, and they're better at it than people like me who came through the schoolhouse, much earlier on when we didn't have these things. So it's an exciting future, I think, from that angle.
So what is it? So we've given the example there of a heads-up display, a virtual reality helmet in a surgery setting. Can you give me a couple more examples of ways in which the metaverse is going to be part
so
of our
there are other. Yeah, thank you. There are other areas that where this will develop. I mean, this type of thing that I'm talking to you about, the augmented reality, is just a small part of it. But other examples of where healthcare is going in the metaverse that I'll talk a little bit about during the conference will include things like telemedicine and what will actually be telepresence. It'll almost be like a doctor's with you remotely. That's an area that's going to expand. It already has taken off with COVID. We learned how to use telemedicine to our advantage, but that's only going to get better. There's a technique known as digital twinning, and this involves, developing systems based on the real world and doing simulations to ask questions and do predictions about how to better treat patients in medicine. And then, of course, virtual reality, augmented reality, and then what I would term metaverse-enabled surgeries. So an example would be, somebody in a remote part of Africa with perhaps limited resources through an internet connection may be able to save someone's life by having an experienced surgeon, perhaps in the UK, Europe, the United States, who is right there via an internet connection, providing assistance through virtual reality technologies to help that surgeon save someone's life or do a procedure they've never done before. And vice versa, we will be able to bring people potentially in areas of the world via an internet connection right into my operating room, where I have all of the latest and greatest tools and toys and show them how we can do these surgeries, and they can use that to improve their own skills.
It's fascinating, Tim, because I think you look back. I look back. We talked at the beginning about Ross and myself having done 12 years of Arab Health, and if you think about 12 years ago, at the first Arab Health that I attended, I remember there was a lot of conversation about, digital health is going to be huge. And a lot of people were sitting there at that point 12 years ago going, what is digital health? What is this digital health thing really going to mean to the world? And you fast forward 12 years, COVID, et cetera, and the idea that you have your medical record on your smartphone, the idea that you have a virtual consultation by video is now just a part of our everyday life. In a way that we couldn't have predicted 10, 12 years ago. And what I think is fascinating, the reason why I absolutely recommend everybody to come to this event on Thursday is because this, I think, listening to what you're saying, is where we're going, isn't it? What we saw as digital health 12 years ago is what the metaverse is now. It's the thing we're going to be talking about for the next 10 years. Is that right?
100%. And, it seems like, so, for example, we still struggle in medicine in the most developed countries with, let's say a patient comes to my office, but they come from, a remote area from across the country. Just getting their medical records integrated in a digital fashion is still a major chore. But that's going to be part of the metaverse in the future, so that you won't need to carry x-rays, or a big one in my field is I'm very image focused. I need to see images of the patient, of their anatomy, of their spine, to be able to make decisions about surgery. And it's amazing how at this point, we're still limited in our ability to transfer that data from, let's say, a CT scanner across the country, so that I can bring it up on my computer and view it, where I'm seeing that patient. We're making improvements, but what's going to happen is, people are going to carry a digital chip, if you will, or there will be a big cloud where all of this data will be stored, and I will have access to every single piece of medical data for every single patient that visits my office, and it'll all be integrated in one location so I can access it more easily. But this is where some of the ethical issues come into play, and this is where legal issues come into play. How do we protect that data? How do we keep that data from being pirated? And that's going to be a challenge. But the computing ability is going to make health records and the digitalization of medicine much better. But we still have a ways to go, believe it or not.
I think it's interesting. I mean, what fascinates me, I mean, I come from a background more as a sort of health systems development geek. And from that perspective, I look at what you're saying and look at the consequences of what you're saying from the perspective of things like the global workforce crisis. You know, how we can use this kind of technology and the ability for people to deliver healthcare quite literally from one side of the world to the other, making a difference to not just the ability to enable and make the most efficiency of the healthcare workforce, but also universal health coverage. You know, how do you deliver healthcare, particularly even things like the idea that you could deliver complex surgery in sub-Saharan Africa in a rural community using equipment on the ground, but a doctor at Johns Hopkins, for example. Is that going to be possible? Is that going to be part of our future?
I think that's where we're moving. Yeah, I do. And, that's the big one that you touched on is, I think across the world, one of the big buzzwords is access. How do we get everyone access to healthcare? It's a very complicated topic. I don't want to go into details, but I think this type of technology begins to enable that, as you touched on.
Well, Tim, I'm going to have to just stop it there. I could literally talk to you all day, and be very careful that I don't corner you at the Metaverse event on the Thursday of Arab Health, because if you let me, I probably will talk to you all day about it. Thank you so much for your time. Really looking forward to seeing you. Reem, just quickly back to you. Can you just tell everybody when, where, and how they get a ticket to this event?
Okay, so the event is at the Museum of the Future on Thursday, February 2nd, starts at 11 till 2. However, please note that the event is by invite only. So what I'd like to say, if you are a C-level in healthcare, if you are a CEO of a hospital or a government entity that involved heavily in healthcare and is still not yet in our confirmed guest list, do get back to us via email. You can email us at informavip@informa.com, and we will get back to you. I must say that we are almost full in capacity, but we will try to do the needful. This is certainly a must-attend event for you. You will have the opportunity to be in this exclusive space that we are creating, a network with the elite gathering of leaders in healthcare. You will exchange ideas together, and you will hear from the industry leaders and see what's happening in terms of the tech showcases that we will be having. And as well, you will be part of contributing to the future of healthcare delivery.
It's going to be an outstanding event, Reem. I'm really, really looking forward to it. I'm really looking forward to meeting you, Tim, in person. We must move on. I literally could talk about this all day. It's absolutely fascinating. But I want to move on and bring in Christina Sahatsky from Al-Tamimi, Mohammed Fayek from Afizo, and our good friend Mansour Ahmed from Colliers. Really for an insight into the market. We're going out to the Middle East, we're going out to Dubai for Arab Health. What can we expect? What's happening in those markets at the moment? Christina, if I can come to you first, what are the big opportunities in the Middle East that people coming to Arab Health should be looking out for and thinking about?
Well, I think going first, I might lay a little bit of groundwork, because I think in understanding the opportunities is understanding the framework, the healthcare framework in place. And particularly in Saudi and the UAE, what we're seeing is a maturation of the framework, including in both countries, a separation of the healthcare provider and the healthcare regulator at the governmental level. And I think that's important to know, because you have to understand who your customer is. When you're looking at governmental entities in Saudi, are you approaching the Ministry of Health? Are you approaching the New Health Holding Company? Are you approaching the Eastern Health Cluster? And this is even the case when it comes to the provision of physical goods. You have a national unified procurement company in Saudi. They are the ones handling all the procurement of medical devices and the like for all the governmental entities.
And
so
they've
when
got
you're
an
coming
enormous
out,
stand about two doors down from ours, I think, the Nutcad. Sorry,
yes.
Christine.
So go talk to them, right? So this is important to understand the framework you're entering into. And I've seen time and time again, people will come to these events and not know the market. And so they're not even sure who to talk to. But if you want to sell your products in Saudi to governmental entities, go to the NUPCO stand. So I think that's the first good background, is to understand who your customers are here. If you're simply looking at the private sector, of course, a lot of private sector entities will be there. But who are the big ones? Do that sort of research. And then know the regulatory environment that you will be subject to. This is another thing, when you're looking at potential partners, they're quickly assessing, I think, your knowledge of the market to really understand if you're serious. So just over time, of course, there's been many companies coming in wanting that quick win, but particularly in, for example, Saudi, they're looking for people that are really looking to invest, because historically, it has taken a little while to get projects up and running, particularly that, again, going back to Saudi, it's been very much the strategy phase for quite some time, but that's quickly changing. But these projects do require upfront time and effort investment. They're not going to happen in a quick 6 months. Very few will. And so to that end, I would say the opportunities are going to be in terms of very specialized care, filling the gaps. So I would familiar yourself with, for example, the strategy that MISA, Ministry of Foreign Investment here in Saudi, is putting out. Familiar yourself with the Dubai Health Authority's strategy. They will identify for you exactly where the gaps are, exactly what they're looking for. And I think that's a very helpful start.
And of course, I think it's worth plugging on both of our behalves the fact that we've got a couple of really good events going on, haven't we, during Arab Health. At 8 a.m. we have breakfast on both the Tuesday and the Wednesday morning in partnership with Al Tamimi, where we're bringing together panels that are going to be discussing specifically the opportunities on Tuesday around Dubai and the UAE, and on Wednesday around Saudi. Which, if you have a look on the Healthcare World website, and I think we'll be promoting those on LinkedIn. Please do go and have a look and register yourself. See if you can get a ticket for those events. They are going really fast, and you'll see a lot of the people and some really fantastic people actually speaking at those events. One of whom will be Mohammed Fayek from Efiso. Mohammed, Christina was talking about Saudi particularly there as being an area of opportunity. I know that's one that you're heavily involved in. What's your kind of take on opportunities in Saudi and how people can approach the Saudi market?
Yes, actually, I capitalize on what Christina has mentioned. And Saudi had spent a quite good time in strategy formulation, since announcement of Vision 2030. The healthcare sector, one of priorities, at that time. And they have spent quite good time with strategizing the system and formulating how this transformation will happen. But now it's a time for execution and operations. And we see a huge opportunity for all stakeholders and the players in healthcare, with some sort of supporting this stage, this critical stage, where these kind of mega strategies will reflect into the unit of healthcare system, which is the patient-doctor relationship. And this will reflect into healthcare outcomes on individual and the communities level. The stage is critical, and it needs lots of innovative ways. We have a longer discussion now around some different types of innovations, disrupting the healthcare ecosystem, even in the delivery way, how we deliver service, how we integrate with each other as partners in the healthcare system. We have to look into innovation as well. So operation side is critical. Taking it in a very innovative way, and in this rapidly changing environments and world and different circumstances happening now, we are living in VUCA world, as we all know. We have to be very adaptive and very agile, you know, to help and support the different care providers at different levels. The system in Saudi Arabia is, it will be a leading healthcare system in the region. When we see, you know, this kind of transformation with all bits and pieces of the system working together, having this kind of umbrella of universal health coverage, you know, under Daman and other organizations, the digitalization that is happening in this area, payment models that we will see, it will be fascinating actually, and it will be a role model for the whole region, and putting our effort and focus on supporting such system and investing from our side, investing ourselves, it would be a very rewarding strategy in the near future.
It is fascinating, I think, if you look at Saudi Arabia, and I think I've been to Saudi 3 times in the last 12 months, and the pace of change in the country is incredible. The pace of social change is incredible. I've found generally that that in Saudi Arabia, we're dealing with a healthcare system and a group of people who are intelligent, interesting, engaged, very, very friendly, and very much willing to listen and understand the lessons and opportunities coming from different healthcare systems around the world. And it is a hugely exciting time. As you know, nodded earlier on to the fact that I'm a bit of a health systems geek myself. So the whole idea of they're building essentially a brand new health system from scratch, creating with very little public health legacy, or most of that having come from the military, creating this initially free at the point of delivery, but then ultimately insurance-led health system, through the holdco, through the vision realization office, through the clusters. I guess my question, Mohammed, is this: we've certainly, from my point of view, from the international community point of view, we've heard a lot over that 12-year period that I've been involved in with Arab Health about Saudi as an opportunity, and yet there's always been a lot of talk and a lot of discussion. Are we now in a situation where finally we're really starting to see action? Is now the right time for the international community to be engaging in Saudi Arabia? What's your perspective?
Absolutely, 100%. Since the last quarter in 2022, I was saying 2023 would be a turning point. I mean, it's an inflection point for the healthcare system in Saudi Arabia. And this obvious when we see this kind of leadership change, and some people are taking over just to accelerate the pace of execution and to get it done. I mean, from especially from cluster maturation perspective. There is a huge effort, you know. The political leadership has given their blessing, and you know, with the declaration has been announced last year to move the assets from MOH to the health holding company. But again, we as humans, we all understand that the change can't happen, you know, overnight, but it needs lots of effort. Actually, what is happening in Saudi with the pace of a change is amazing. And people who are implementing this, who are working in the healthcare system, they have a great appetite for a change. And they are, of course, there are some resistance. Some people doesn't understand our role as partners, as stakeholders with the government involved in this process. We have to help, and we have to provide the right support, the right level of support to this kind of a change. I see this transformation happening in healthcare system in Saudi. It's once in 10 years period, you know, and witnessing this, I feel myself and my colleagues as well is proud to be involved in this, in such a transformation since 2015. Since since announcement of the Vision 2030. I feel myself, you know, proud that I have been part of this transformation journey. And this year, specifically 2023, will witness lots of, you know, graduation, if we can say, the graduation of many clusters. And we will see, you know, the beauty of integrated care model between different levels of care, having some services would be to the private sector, will be the insurance. We can't neglect also the initiative that Saudi Arabia is taking in the region, and to bring value-based care on the ground. You know,
Mohammed, it's hugely exciting, without a shadow of doubt. We must move on.
Exactly. Yeah. Sure.
I think Saudi is a massive opportunity, but let's also talk about the UAE. Mansour, I think you've been active in both markets for a long time now. What do you see as the big opportunities out there in the region at the moment?
I think if you look at the different opportunities, first of all, I would say that there are three major markets. Obviously, Saudi is leading, and then we have an Egypt, which is a very good big market of 100 million plus people, and then we have a UAE. And so all three markets have different demand drivers. They have different needs and opportunities. In case of UAE, if you look at the overall picture, there is more and more focus on specialization. We do a lot of feasibilities, need assessments and other, but normally now in UAE, we are looking at, should we have, you know, cardiac care hospital? Should we have a pediatric care hospital? So there is a need and focus to move into specialization instead of having a tertiary care hospital, because the tertiary care hospital, there are good enough number of hospitals and bed, and there is a need for a specialization, which is the main theme by Dubai Health Authority and Abu Dhabi and everyone. They are basically looking at what are the specialization. Also UAE during the COVID, as gradually things start opening, there is UAE is becoming, and especially Dubai is again attracting a lot of medical tourists, and it was because of one of the reason was that till last year, early last year or so, a lot of people cannot travel to Singapore and other places, and they don't have a choice. But when they come here, and I had, without going into detail, I had some personal experience, and then one of the family member came who don't want to go to anywhere else except Singapore. And now they start coming back again and again here. So the quality was there already. It was just that there is opportunity, you know, arises, and Dubai become more safe, was more safe and open before a lot of other countries due to COVID. So I think medical, so Dubai, UAE will talk about that there will be more specialization. There will be more center of excellence, and there will be a focus on, I must highlight across the region, including UAE, there is also need to focus on medical teaching or medical education. And we will be publishing with you an article on that in our upcoming magazine. There is, because that is another thing, is that COVID also exposed that if you are relying too much on foreign, medical personnel and resources, that is so there is a specialization. There is a in across the region. In case of Saudi, there is demand for everything, and demand is also where I focus. My previous friends discussed that. I think there's an opportunity, especially for British operators, to come and operate hospitals, clinics, and other things there. And beside the telemedicine and other, there is a demand for British branded, I would say, I mean, American hospital also, German also, but there is more opportunity for British hospitals to come and operate the branches there. As you are aware, King College is opening in Jeddah, Mediclinic is opening in Jeddah, but the way Riyadh is opening, there is a lot of demand, and one of the key thing which we are working is attracting those British operators to the region, especially to Saudi. At this moment, we were discussing in the final stage of discussion with one of them, and there will be some more there. So I think from my point of view, if you are looking beside the telemedicine and other, there is still demand for the traditional healthcare, services, which are clinics, hospitals, daycare, but it is becoming more and more specialized. And those who want to come and explore, they need to understand the market and how to do the partnerships. That's very important, because unless you don't know how to do the partnership, you will end up wasting a couple of years.
Useful insight there, Mansoor. Thanks. One thing I want to pick up on, Christina, I want to come back to you on this one, is in terms of the opportunities in Dubai. You mentioned there, and this is something that I've talked about in my opinionated column at the back of the edition of Healthcare World, that you'll all no doubt in the audience be picking up at the entrances to Arab Health. Read the opinionated column, and actually one of the things I talk about there is this idea that in our post-COVID world, education and training is so massively important, and growing your own workforce. And I think what's really interesting, Christina, and I'd like you to sort of speak briefly on, is the way in which Dubai in particular is trying to tackle that problem with the establishment of this new Dubai Academic Health Corporation that's kind of creating, and I understand it, and perhaps you could give me some insight here. As I understand it, they are going to be the public provider, taking over the DHA hospitals, the Al Jalila Foundation and the Al Jalila Children's Hospital, but perhaps most pertinently of all in that education and training space, the Sheikh Rashid University, and the training up, one would imagine, of what is intended to be an indigenous Dubai workforce in healthcare. Can you tell us a little bit about that? Because I know that's going to be a key part of our session on Tuesday, isn't it?
It is, and we'll have representatives from that entity there. It's still under transition. We're actually working with them to transfer all those assets and facilities, and as you can imagine, quite a big job. So the details of it all are not quite fully there, but of course that is, as you mentioned, one of the key goals of this sort of split between the regulator and the operator is then to allow the new academic health corporation to focus in on this, to focus in on research activities, to focus in on training, to create the right partnerships with those. Of course, we see quite a few from the UK there to do those knowledge sharing projects, to create the homegrown knowledge. Quite, as you know, quite a lot of the workforce is imported. And with the global workforce shortage, that's not sustainable, particularly with changes in politics, for example. This is also creates an issue if, for example, where you have a predominant nursing workforce from one country, but the political nature of the relationship goes sour, you potentially lose quite a big foundation to your healthcare system. And so we see this theme in other countries as well, and in Saudi, but of course, this has been one of the core initiatives of the new Academic Health Corporation. And indeed, at our session, we will get to hear straight from them more of the finer details on that.
I think it's fascinating, and in some ways it almost is following that Saudi model, isn't it? And if you look at what Saudi has done with the establishment of the health holding company and the clusters, and the development of a public health provision, Dubai for the first time going away from the idea of being 100% insurance-led and creating a public healthcare provision of its own, which it hasn't had in the past. So I think that's going to be absolutely fascinating. Please, audience members, go and have a look on LinkedIn. Have a look at Healthcare World's LinkedIn page. You'll find details of how to apply for tickets to both the Tuesday session, which Mansoor will be featuring strongly at, and our Wednesday session on Saudi, which Christina and Mohammed will be sharing more of their insight. We must again move on. And I think for the final part of today's session, what I'd like to focus on is the international organisations, the international presence that we're going to see at Arab Health. Why is it that organisations and governments from around the world come to Dubai every January to understand what's happening in this Middle Eastern healthcare system, what opportunities there are for them, and how they can get involved in creating collaboration? And I'm going to start with Vincent Bishami from Bevan Britain. I mean, Vincent, I think when we were talking pre-session, this is what, about 5 or 6 Arab Healths for you now. What keeps you coming back every year?
Well, thank you, Steve. It's a pleasure to be here. Thank you for inviting me. I think for us, it's really goes back to what was being said early on. It's a huge international conference, and it's one that provides a really, despite its size, a relatively easy platform to connect with, hundreds of local and international providers, operators, suppliers, investors, in a wide range of different market segments. And that opportunity to network and build connections or reinforce connections you've already got is a huge benefit. It's also, not beyond the conference, all the fringe events and the trade show aspect that forms part of it gives us an opportunity to keep up with new trends and new developments across the industry. So you get to do all of that in one place over a few days and rub shoulders with, I think Ross said, 50,000 delegates, 3,000 companies from like 170 countries. So, why, if you're in healthcare like we are, it's the place to be. So why wouldn't you be there? It's a bit of a no-brainer, really.
And I think, I want to come to Jed Byrne, Health Education England, and the man tasked with helping to create the NHS consortium, which will provide much greater access to NHS expertise for international markets. What are you looking to get at? What's the NHS looking to get out of being involved in Arab Health?
Afternoon, Steve et al. And thanks for the invite. Can I just apologise? I'm at the back end of man flu, which, as you know, being a man, has put me at death's door for the last 3 days. So I'm just recovering at the moment. So apologies if I don't make an awful lot of sense. I think we in the UK, working within the NHS, and particularly clinicians such as myself, see the NHS as a relatively unique universal health coverage system, mainly because of its age and size. And we've recognised that as a brand, two things really. One, that as a brand, it's quite powerful and certainly conjures up some sort of emotion, depending on which forum you happen to be speaking within and to whom you happen to be speaking. But we're also very much aware that we've been a terribly insular organisation really for 74 years, and that in order for us to move into 21st century universal health coverage, which I think is still the basic political driver for us, we need to transform in quite a big way. And so we've spent the last sort of 3 or 4 years looking at how we can crystallise that both that knowledge of system development and workforce development, together with 74 years of experience, and move it into both a commercial and an overseas development marketplace. And we spent the last 3 or 4 years working with 8 governments of emerging economies, looking at as strategic partners for health system strengthening. And that programme has had mixed success and very, very good success in certain areas and less so in others. For phase 2 of our development, we're looking to create a single point of access, really, for external partners to develop partnerships and trading and co-development relationships with the NHS. The consortium itself already has 11 arm's length body members, and you'll be familiar with most of them: NHS England, NHS Improvements, my own organisation, Health Education England, UK Health Security Agency, NHS Digital, NICE, etc., etc. And we're working together to look at how we can best place that knowledge and experience within a global marketplace in three broad areas, I think. One is in a sort of consultancy role, in the sense that the one advantage that we have is a really good reach into frontline healthcare services, and the NHS, as you know, employs 1.4 million people, so it's not a small workforce. Then as a strategic partner for those individuals who are looking to develop health system strengthening in country, and then finally to enable the components of our health system to work and develop commercial partnerships globally. And you mentioned Kings, and before, there are numerous examples of that, but I think we're currently hiding our light under a bushel in a big way. We've got lots more to come. So for me, this year's Arab Help is very much developmental. And what I'm trying to do is to crystallize a system, if you like, for the NHS to be more effective as an engaging within an international commercial and health system strengthening marketplace.
I think it's interesting, isn't it? Because I think, if you look at the NHS has had a good relationship historically with the Middle East. Mansour mentioned Kings. There's also Moorfields Dubai. There's also work that's been done. There are an enormous amount of ex-NHS people working as consultants in Saudi Arabia. Mohammed was talking about the scale of the transformation program there. So clearly there is a huge reputation and desire across the Middle East for engagement with the NHS. The issue for me, and one of the reasons why I'm really excited to be working with you, Jed, on this programme, is that historically it's been patchy. So it will be down to the ambitions and the desire of individual trusts and bodies to engage internationally. Sometimes that can take the form of smaller projects that kind of don't end up, that sort of meandering off and not going anywhere in particular. Sometimes those things can be based around individuals or clinicians. But I want to understand this properly. Is what you're saying that for the first time we are trying to develop, or we're seeing the development of an opportunity for Middle Eastern providers, suppliers, governments to engage with the NHS at a central level on a top-down basis, rather than having to rely on smaller individual organisations? Is that the direction of travel?
Very much so. So I don't think the NHS per se as an organisation can compete both with the agility and experience of international consultancies, and I don't think really that's where the NHS's future lies. But what it can do, of course, is reach to a very active front line, both in terms of obviously individual clinicians, managers, leaders, but also at a meso level to local health system structures, people who are actually delivering universal health coverage at a reasonably efficient way in local and regional areas, and mobilize those individuals to work in partnership with people on a global scale. So I think we're looking to use our own individual strengths, but at the same time not try to create a sort of second class of consultancy, if that makes sense, Steve.
Mm-hmm. Absolutely. And it is, and I think the key to this is you talked about 74 years of experience. There can't be too many healthcare development, system development problems that we haven't seen in the UK over 74 years. So when we're talking about, and again, I come back to that example of Saudi Arabia, developing a new health system from scratch, is there almost an element here of we're not necessarily selling our successes, but we're selling the scars on our backs?
Oh no, it's completely that. In fact, and I very often say, in fact, I've recently said on one of your missions, that we have made every mistake under the sun, and have a good working knowledge of those mistakes and where we've gone wrong. A very good example of that. If you look at this is a challenge to all those who really understand healthcare. One of the big problems, apart from workforce and health and social care integration at the moment, is elective productivity. And if you look at elective productivity, the fundamental issue driving elective productivity down in universal health coverage systems is actually the patient safety agenda. And because as we're introducing more and more layers of patient safety protocol and bureaucracy, our productivity levels are reducing, which of course is then driving up the unit cost for any form of healthcare. The paradox to all of that is that avoidable patient harm has remained relatively static in Europe for the last 25 years, despite all of that issue. So a recent conversation I had in South Africa with the National Health Insurance Program in South Africa, I was asked if we could introduce or give advice to South Africa on patient safety because they were noticing an increase in litigation rates. And of course, my response to that is, yes, we can give advice, but the advice I'm going to be giving is under no circumstances copy us, because you'll end up not reducing avoidable harm, but driving up the cost, and litigation won't change. And so I think there is an element, Steve, of learning from the mistakes of the past, which is even more powerful from some of our successes.
I think it's a really interesting point that you make as well, which is that one of the things that people outside of the UK, some of our watching audience in the region, for example, may not understand, is that as a national healthcare system and a national healthcare provider, the NHS is quite a large and unwieldy beast. So, it's very much about, if there are, you talked there about the conversation that I'm very familiar with, having kind of introduced you to those guys in South Africa. You talked about that specific example. We had another conversation, I think, about I think it was in Switzerland, talking about e-procurement and what we've done in the UK from an e-procurement point of view. But it's that point, isn't it, about what you're trying to achieve and how can you help by reaching into the NHS from your central point to find the right expertise. I mean, is that something you're able to do? If a health system or a provider or a government comes to you with, Jed, you know what, we've got this problem with clinical pathways for cancer, can you find them the right person? Are you able to hook them up with the
absolutely.
Right
We've got dozens and dozens of examples of that. So we established 4 years ago, we established a call down facility called CTAS, which is a growing relationship management database of key leaders and subject matter experts within the NHS, working at regional, system level and local level. And so we are able to put a package of measures together. I mean, the big demands for us at the moment are around workforce planning, they're around e-procurements, and we're able to mobilize groups of individuals to develop plans either as a strategic partner or as a delivery partner for various aspects of system strengthening, depending on what the demand is. The way in which we currently function as a consortium is to try and create some sort of gap analysis between the particular desire of any particular client and what our own experience is and what we're currently doing in the NHS, and then work with that client to attempt to close that gap. And as I point out before, one of the great advantages of working for the NHS is that we're constantly looking at improving our own healthcare offer to the UK population by entering into these partnerships. So we have a sort of double whammy of motivation, really.
Yeah, it's not necessarily just about commercial opportunity, although obviously income is important and how you pay for things is important. But it's also about the experience that you can get back from working with high-level people. And I think that's key, isn't it? It's about creating it's not a salesman-client relationship. It's very much a question of, we want to get experts from the UK and experts from the region in a room together, swapping ideas and coming up with stuff that benefits both ways.
Spot on. That's exactly the way we see this. I mean, somebody once said to me, the only difference between a good business and a good charity is what you do with the profits. I think everybody ultimately recognizes that the world runs on fiscal investment, and we're not frightened of that. But I think we also recognize that if we're going to develop a universal health coverage system which is fit for purpose for our own needs over the next 50 years, then mutually developmental partnerships are very beneficial to us as well.
And it's also, you mentioned that thing about large consultancies earlier on in the conversation and not competing with them, which I think is right. But the difference here, I suppose, is that as a health system, you're not a consultancy, you're providing some consultancy services, but doing so from the point of view of experience, of actually having done this stuff, of having touched the patient.
Yeah, absolutely. So we think we have a series of USPs really, and we've got so there's a series of sort of subject-based experts, sort of technical capabilities around health security, climate change, workforce planning, development, health financing, digital health transformation, things which have sort of been innovative, sort of R&D type stuff internally. But we also think that we have quite a bit of expertise, as we've already discussed, in terms of system development and what works and doesn't work within integrated system development. But the big difference for us is we're an active healthcare system. So who will use the big four international consultancies, because we recognise that our role is not as a consultant, our role is as a doer. But what we're trying to do is to create an interface so that we can utilise that knowledge of doing for the benefit of other healthcare economies, and to generate investment into the UK as well.
And from that point of view, you mentioned that the purpose this year of going to Arab Health is to start to scope out what some of these relationships might look like, what the needs, what the conversations and discussions are. How can individuals that are watching here today that want to engage get involved in talking to you guys?
Well, I mean, we're open to conversation, immediately open to conversation at any stage, as you know, Steve. And we're not right at the beginning of this journey. So we're 4 years into this journey and already trading. So it's not like we're looking at something in the future. We're looking to position ourselves in the right place. So we're looking for strategic partners. We're looking for partners who may want us to do regional transformation pieces or local transformation pieces. And we're also looking for people who we can simply sit down with and talk about our ideas in this space and look for advice as well. So I think we're at that stage of development, Steve, if that makes sense. I suppose it's important to contextualise that we're undergoing yet another reorganisation internally of the NHS at the moment. And from the 1st of April this year, we'll have a single executive arm's length body with responsibility for managing the NHS, the new NHS England. And my own unit will become the global unit for the entire system. So it's quite important for us during this transitional period to make sure that we place ourselves in the right position for our global commercial relationships.
Well, it is. We're going to be keeping you very busy during Arab Health with a whole bunch of really, really interesting meetings. And somebody else we're going to be keeping very busy during the course of Arab Health, and thanks very much for your patience, coming through to a different Northern European country and another one that has a strong relationship with the NHS. Bjorn Alma, you've heard what Jed had to say from a UK NHS point of view, and I know we've had numerous discussions about partnership between Sweden and the UK. What are you looking to get out of Arab Health? What's your kind of offering to that Middle Eastern market?
Hi, thanks, Steve. For us, it's very much like Jed says as well. It's about connecting with other markets and sharing experience. And as he says, also we are very much doers, which makes it very exciting now. If you look, for example, at Saudi Arabia, 2030 is really much approaching. So we're moving from a more theoretical setup phase. We've had subject matter experts on site in Saudi at the health holding company at the top level for quite some time. But now we're moving over to the actual doing phase, and that's even more exciting because as a healthcare provider, both NHS and the Swedish government system, we can be very useful for countries in this phase of transformation because it all handles about getting the vision to actual healthcare. And as you said earlier, also it's very much about not just the ideal state, because everybody can paint this fantastic optimal picture, but it's about learning from the mistakes and being realistic about how to get it done. So for us, it's very exciting, and also what it does is that it provides. We're a small country, so we always relied on international collaborations. It gives us feedback as well on what's happening in healthcare around the globe, and we can also develop on our side. So in terms of the consultancy services we provide, we do fill a gap between the big consultancy firms and the local management struggling to get it actually done on a day-to-day basis. So we find it very stimulating.
So from the point of view of the Swedish health system, what is it that motivated, that made the Swedish government turn around and say, you know what, we've got something pretty good here, and we've got an opportunity to export some of that expertise? What is it that kind of provided that catalyst?
Well, I don't know the political background to this opening up quite some years ago, but it's been very fruitful for Sweden in terms of the collaborations that have come about. And as you know, we have a workforce challenge in all our countries, keeping people in the industry. It's not just about training doctors and nurses, it's about keeping them motivated. And for us, being able to send our most talented doctors and nurses out on exciting projects. And then, for example, we got a thank you note from the CEO of one country's main hospital just a couple of weeks ago, where they didn't have a stroke pathway before. So we involved our best stroke pathway people over a couple of years, and now they are using the stroke pathway in this country and saving lives. Now, of course, that makes the doctors and nurses involved in the project extremely satisfied, having been involved, and also it makes them feel very valuable. So there's of course a consultancy income itself, but that is not the main point. The main point is getting all these international stimuli into our system, because the day-to-day service providing of healthcare is not always glamorous. But when you can get this international flavor to it, and of course we can't send all our doctors and all our nurses, but we do provide, and also since we do provide training for specialist doctors and dentists in Sweden since many years, we get all these international flavors, and we're getting such positive feedback from the clinics where they are, because you get a new perspective on things. So it's both the monetary side, because it's know-how experts. We are not making so many cars anymore, the others doing that, but we do have the know-how which we can export. So for us it is a huge benefit, and we're enjoying it.
I will admit that I do miss my old Saab. It was a great car.
It's a shame. I'm sorry about that.
Why specifically the Middle East, and why Arab health?
Well, there's so much exciting transformation. I mean, the needs are in all countries. In the Middle East, they have been very concrete in the structural change, and it's so exciting because there's very young management. As you know, in a more older or more developed healthcare system, you get a bit stagnant, and there will be resistance to change. And that's why it's so exciting, because there's young management. They've gone to the best schools around the world. Now they want to implement all these exciting visionary improvements. And if we look at home, at times there are a lot of people saying, well, that can't be done. We tried that 1976. But if you're in this environment, you get all this excitement, and that is really stimulating.
think that's a fantastic point, actually. And I nodded to it earlier on with Mohammed when we were talking about Saudi and the willingness to listen and the desire to create the best possible outcomes and opportunities for patients. I think that's a fascinating insight and reason. And let's be honest, and there's also an element here that is financial, that the region has the resources to be able to do a proper job of its healthcare. We've heard that from Sweden, from the UK, from a couple of public sector angles in terms of their reasons for bringing delegations and coming to Arab Health. Vincent, I want to come back to you, if I may, for a moment, and I'd like you to kind of represent your private sector clients for a moment. What is it that you think that UK commercial organisations, whether they be suppliers, whether they be providers, digital health companies, trainers, what is it you think that they are? Because we see there's over 100 UK companies that come out to Arab Health every year. What is it you think that they're looking to try and achieve? And again, same question as before, why the Middle East and why Arab Health? Okay,
thank you, Steve. I think for many of the clients that we work with in the context that we have, we understand that the principal reason that they think about Arab Health is because, there are so many C-suite individuals gathered together in one place who have a willingness to meet and greet and to discuss things, to form collaborations and partnerships in a meaningful way. And people have the time and the space at Arab Health to do that, much more so than, back at home when the day-to-day work life gets in the way of that. And so people are more focused and not necessarily keen to get away. They don't have a train to catch to get home or something like that. There's also the reality that, here in the UK, without, or perhaps at the risk of being slightly political, a lot of the post-Brexit opportunities that many businesses had felt might come their way haven't really happened. And of course, part of that is down to the pandemic, but both of those are now behind us. And with some of the post-Brexit opportunities not being realized, many UK businesses are looking to form partnerships and chasing opportunities with partners in other parts of the world. And I think it was Ross who said, just because Arab Health takes place in Dubai, it's not just about doing business in Dubai or in the Middle East. It's about connecting with people to do business anywhere in the world. And for a lot of the UK companies, particularly those who are providing innovative solutions to novel or existing problems, whether that's in the med tech, life science space, or the traditional clinical patient delivery space, it gives them an opportunity to demonstrate, what they have to offer and to generate leads for sales and to form those partnerships. And it's an exciting place to be, and it's great to be a part of it.
That's fantastic, Vincent. I almost feel like you've done my summation for me. It is, and it's, I think, 12 years, and every year I look forward to the end of January. I look forward to the trip to Arab Health. I look forward to I remember last year, really sort of coming out of the pandemic to the first proper international event that we'd done in 2 years, and just the return to the bustle, the crowds, the huge number of people, the huge number of really insightful conversations, the friendships that we've formed over the years, UK companies, Swedish companies, Middle Eastern companies, African and American companies. It really is the global gathering. It's the one that I think every healthcare professional looks forward to at the end of every year. And again, we'll be there this year with a packed programme. Pick up your copy of the magazine at the entrances. You'll see many of the familiar faces that we've seen on today's session with insightful articles in the publication. And it should be a great week. It only remains then for me to thank my guests this afternoon and a fabulous panel of fabulous group. Ross Williams, event director at Informa and veteran of the same number of Arab Health as me. Vincent, who's managed 5 or 6 of them, I think, now, and will continue to come. Mansour and Collier's always hugely insightful in terms of what's going on across the region. Mohammed and Afizo, who we're working with on some of those Saudi programs. Jed, I think the opportunity for the NHS is huge, and I'm really looking forward to working with you guys to help realise that. Likewise with Bjorn and Reem and Timothy. I mean, the metaverse. Good Lord, I thought that our market was complicated and clever enough, and then something else comes along that blows your mind. So if you can get along to that one, I think that's going to be a fantastic event. And of course, our longtime friends in the region at Altamimi and Christina. I think I've mentioned everybody. It's been a packed program today. Hopefully, those of you who've watched have stuck with us to the end and enjoyed the insight. And hopefully, we'll see you all in Dubai in a couple of weeks. My name's Steve Gardner. I'm the Managing Director of Healthcare World. This has been the first Healthcare World Series event of 2023. We hope to have you joining us for many more over the course of the year, and we hope to see you at Arab Health. Thank you very much, and good afternoon. Goodbye.